So I'm Rob Layfield. I'm the chair of the Paget's Association Research Subcommittee, and the theme of this year's Awareness Day is Paget's research. And so it's a real pleasure to be able to introduce Professor Stuart Ralston, the chair of the association, and we're going to have a bit of a conversation about some of the recent research he's done related to a clinical trial called the ZiPP study that you'll hear about is relevant to Paget's. So, Stuart, welcome. First of all, can I ask you just to tell us about what the ZiPP study was and what it set out to do?
Okay, thanks, Rob. Yeah, well, the rationale for the ZIP study is that people with Paget's disease often don't know they have the condition, often for many years, until it starts causing complications. And by that time, the bones may be bent or they may get broken, or there may be pain. And although there is treatment for people with Paget's disease, that cannot reverse the damage that's already been done. So the aim of the ZIP study was to see if we could pick up the condition early and intervene at an early stage and try and improve outcome, essentially.
Yeah, and I guess so. When you designed this study some years ago, what were you thinking were the important questions? What were the kind of main issues? What main questions you're trying to address with the ZIP trial?
Okay, so the aim of the study was to look and see if treatment with this medicine called zoledronic acid, which is used in people with Paget's, with diagnosed with Paget's, can prevent bone scan abnormalities of Paget's developing. So that a bone scan is a test we use to pick up Paget's. So that was the aim of the study. We wanted to look at bone scan changes. We knew the study wasn't big enough to look at complications, but since we know the bone scan is an indication of disease activity, we thought that would give us an idea if the treatment was going to be effective, basically.
So that's effectively what we call prophylactic treatment, finding folk who are maybe at risk and seeing whether we can have a benefit with an early intervention.
Ex
Okay.
exactly. I
Yeah.
mean, there was three phases. First was what's called a gene test for a gene we know is associated with Paget. So that was the first step. And we picked people who carry this gene that makes them susceptible to Paget's. In those people, they had a bone scan to detect any early signs of Paget's disease, and then they get allocated either to the active treatment, the zoledronic acid, or a dummy treatment or a placebo. Now, neither me nor any of the other researchers nor the patients knew what they had. It was what's called blind. So then we followed everyone up, and it was about it was about 7 years nearly, and then we looked at them again, repeated the bone scan again, and analyzed the results.
I think it's just dawned on me, it's quite telling that it's almost 20 years ago. I think that your research group was one of the first to identify this particular gene variant, sequestosome 1, which probably influences susceptibility to Paget's as well. So, gosh, over 2 decades later, it sounds as though a really telling study has been run where that information now has a clinical value. So what did you find then? This is really, really interesting. What happened?
Thanks, Rob. Yeah, yeah, it is. Well, I mean, it showed that for people that tested positive, overall, about 9%, almost 1 in 10 already had Paget's, but he didn't know it. Okay. And we detected that at the start of the study. And these people weren't having symptoms and they would have been completely unaware of it had they not taken part in the trial. And so half of them were given the treatment, half of them were given the dummy. And then at the end of the study, what we found was it was a big difference in how the Pagets had progressed in people given the active versus the dummy. So I think it was only less than 1% given the active treatment had any signs of Paget's at the end of the study, compared with something like 10% in people that were given the placebo. And also we found that the what's called bone turnover, that's the process that is elevated in Paget's, that was also suppressed very, very dramatically by the treatment. So it was very much a positive result. And I think it's a genuine game changer for people that have a family
Mm.
history of Paget's, I would say.
Yeah, that's really significant. And again, just taking a step back, then something like 9% of those at risk of Paget's, as you say, are living with changes that they're not aware of. And I guess if we were to extrapolate that to the whole UK population, and also think about people who aren't necessarily at higher risk, it does suggest that, as we'd suspected, Paget's really is going underdiagnosed. And I guess our work to raise the awareness at the association is something that we, really have to push forward on.
I think that's right, Rob. I think the other thing that the trial has convinced me of, and I think
Mm.
I'm hoping will convince people in the NHS, is to make this genetic test available for people who
Mm.
have a family history. It probably, not at the childhood stage, but maybe when people are in their 40s, early 50s, have a test then. If it's positive, they could then have a bone scan. And if it's
Mhm.
definitely, if it shows anything, then that would enable you to get in early for treatment.
Yeah, and these treatments such as Zoledronate are really effective as well. We know they're effective and they're safe as well. So it all sounds like it's a positive future for Paget's with respect to clinical management. So let's hope that the Paget's Association can help spread this message, can get the support of the community and of the health community. And it would be great if we really could push forwards and know who's at risk at Paget's and maybe intervene before there's any development and any symptoms, maybe.
Yeah, exactly. That's the way I'm feeling. So, as you probably know, the association is planning to mount a campaign to make this to get this introduced in 2024. And as you say, from the gene discovery 20 years ago to the trial, it's fantastic to see how things have developed, and hopefully this really will make a difference to people with Paget's moving forward.
Yeah, absolutely, real impact. So here's a call to arms then. The whole Paget's family, the research community, those living with Paget's and those who've got family members affected. I think we've got a job on now to spread the word and to get Paget's talked about and the awareness to be there in the general population. And let's really make 2024 a year to try and make a difference. Let's put Paget's on the map.
Thank you, Rob. It's a
Thank you,
pleasure to
Stuart.
talk to you today.